Magandang umaga po sa inyong lahat. Salamat sa paggugol ng oras at pagbisita sa ating Health Talk at your fingertips, the Qualimed Hospital San Jose del Monte online lecture series. Ako si Loven Monding, ang moderator ng webinar na ito. Sa araw na ito, kukumustahin natin ang inyong mga puso. Our health expert will discuss on how to maintain a healthy heart. Upang opisyal na simulan ng ating programa, tayo po ay mananalangin. Iyuko natin ang ating mga ulo at damahin ang presensya ng Panginoon. Our dearest Heavenly Father, thank you for making all things possible. We are grateful for all the blessings that are pouring upon each one of us despite the odds and challenges that we still face. Thank you for blessing us today with this wonderful opportunity to meet virtually and learn together in this health webinar. May your blessings of wisdom and guidance be upon us all, through the sharing and impartation of knowledge and skills by our resource speaker. May all of us learn together, upgrade our competencies, and capacitate us to be of help in the development of our learners' lives and communities in the spirit of your love and generosity. May we humbly commit every part of this webinar to you as we bring back the glory, honor, and praises for your kingdom and holy name's sake. All this we pray in the precious and almighty name of our Lord and Savior, Jesus Christ. Amen.
Amen.
Okay, so upang maiwasan ang mga abala sa panahon ng programa, meron lamang po kaming mga reminders, no? Mangyaring sundin ang mga tagubiling ito. Una, panatilihing nakamute ang inyong mga mikropono, i-off ang inyong video camera. Sa panahon ng webinar, kung mayroon kang mga katanungan, ipadala sa amin sa pamamagitan ng pag-type sa chat box. Sasagutin namin ang inyong mga tanong sa session ng Q&A. Kung ikaw ay nanonood sa pamamagitan ng Facebook Live, mangyaring ipadala ang inyong mga katanungan sa pamamagitan ng section ng komento ng video stream. Alright, so isang ganap na karangalan na ipakilala sa inyo ang Medical Director ng Qualimed Hospital SJDM upang ihatid ang kanyang mga pagbati. Please welcome Dr. Angel de la Razabal. Good morning, Doc.
Hello, good morning, Loven. Can you hear me clearly?
Yes, Doc.
Okay, so thank you for this one. So to formally open this event, to all the participants, our dear patients, guests, partners, and to all our resource speaker, a pleasant morning to everyone. Welcome to the Qualimed SJDM Health Talk at your fingertips. We celebrate the Philippine Heart Month every February to promote awareness of heart diseases as a serious and growing health concern among Filipinos. According to the Department of Health, heart disease is one of the top leading causes of death in our country every year. The 2022 Qualimed SJDM will continue its commitment to provide timely and relevant online lectures that are truly beneficial to all its patients and partners. Last year, we had a total of 23 health talks delivered by our dear doctors who are experts on the field of their specialization. And we promise to give you more health talks and more learning sessions in the coming months. Thank you to Dr. Melco Perez for the Kumustahan ng Puso discussion and for lending us your expertise despite your busy schedule. Again, maraming salamat po, and let's enjoy the knowledge sharing today. Back to you, Loven.
Maraming salamat po, Dr. Angel, para sa inyong inspiring na mensahe. At ngayon, mga kaibigan, tutungo na tayo sa ating pangunahing programa. Lugod ko pong ipinapakilala ang ating speaker sa programang Kumusta ang Puso Mo? How to Maintain a Healthy Heart. Siya po ang tumatayong chairperson ng Medicine Department at visiting consultant dito sa Qualimed Hospital SJDM. Nagtapos ng Doctor of Medicine sa UST Faculty of Medicine and Surgery. Nakuha niya ang kanyang fellowship in adult cardiology sa Philippine Heart Center Natapos niya ang kanyang residency in internal medicine sa Chinese General Hospital. Please welcome Dr. Melco Perez, nuclear cardiologist. Hi, Doc!
Hello.
Kumusta ang iyong puso, Doc?
Good morning, Loven. So far, Valentine's lang naman. So, I hope you also had a good Valentine, Loven.
Yes, Doc. Thank you,
Good
Doc.
morning, everyone. Good morning, Dr. Angel. Good morning, our dear patients and partners. I will be talking today about your heart, no? About our heart, by the way. Kasi I have some slides here that I want to share. Maraming salamat pala po sa pag-invite sa akin dito sa webinar na to. This is really indeed a wonderful experience for me to be talking to everyone. So I do not know if I have shared my slides.
Yes,
Is it
Doc.
okay na, Loven?
Yes, Doc. We can see it.
Okay. So, mag-umpisa na po tayong lahat. Again, maraming salamat po sa pag-attend po ninyo dito sa webinar na to. Alam ko pong lahat tayo more or less may idea kung ano ang dapat gawin natin, anong dapat hindi natin gawin sa puso natin. Pero malamang po, marami sa atin masyadong busy or ang attention masyado nasa Korean novela. Kaya minsan nakakalimutan na rin po natin kung ano ba talaga ang dapat natin gawin sa puso. Pero ano lang po yan, everything that is good for the heart, everything that is healthy is just a matter of habit. So ang una pong gusto kong sabihin sa lahat, ito pong puso, no? Our heart is, we only have one heart. Ito po parang parang pump ng tubig na nagpa-pump po yan continuously from the time that we were born hanggang mamatay na po tayo yan. No? Talagang tuloy-tuloy. You can just imagine it can pump 4 to 5 liters of blood every minute at rest. Tapos syempre pag may ginawa po tayo or nag-exercise tayo, syempre mas dadami pa po ang pinapump ng heart. And that is the normal response po ng puso natin. Bibilis ang takbo ng puso, syempre mas maraming dugo ang dapat i-circulate so it can cope up dun po kung ano whatever activity we're doing. No? Dun po sa pag-pump ng puso, hindi lang po nagpa-pump ang heart. It can supply nutrients and oxygen. Yung pong mga kailangan natin talaga sa mga kailangan po natin talaga sa everyday living, no? Yung talagang ba't lumalabo dito? Okay. Yung pong talagang mga kailangan natin ng mga vitamins, mga minerals, everything. And very important yung pong oxygen. So, how does it reach our body? How does it reach our muscles? Ganon. Pinapump po ng heart yan. Now, sa puso po, meron tayong tinatawag na coronary arteries. Dapat po kasi medyo, when we're talking about the heart, dapat po meron tayong konting alam na technical sa puso. So, ang heart po, meron tayong tinatawag na coronary arteries. Ang coronary arteries, ito po yung mga ugat sa ibabaw ng puso na nagsusupply po na nagsusupply siya ng blood to the muscles of the heart. Siyempre po, ang heart is a pump, no? It's working every second. So dapat po, yung muscles ng puso, dapat very healthy rin. So paano po niya nasusupplyan yon? Through the coronary arteries. So yan, meron po tayong puso, muscle ang puso actually, and then, of course, sinusupplyan siya ng blood para malusog ang muscle ng puso through the coronary arteries. Ngayon, ito po yung litrato sa kanan. No? Ito pong litrato na to, ano po to pinapakita ko lang po sa inyo kung paano po ang hitsura ng puso inside. Okay? So, kung paano siya nakikita. Makikita po natin dyan na merong palang mga maliliit na rooms, no? Parang may mga kwarto. Yan po yung mga atrium, yung sa taas, ventricles naman po sa baba. Anyway, hindi nyo na po dapat kabisaduhin yon. Ang dapat lang nila pong malaman, meron tayong palang maliliit na kwarto, doon po pumupunta yung puso, tapos pag nagpump po, ay yung dugo pala, pag nagpump po yan, lalabas po yung dugo, magsi-circulate and then babalik ulit sa kanya para kumuha ng oxygen. Okay? So, yan po ang nangyayari sa puso natin every second. Now, meron pong dalawang terminology, no? There are two terminologies. One is, minsan nakakarinig po tayo ng word na atherosclerosis. So, ano po ba talaga yung atherosclerosis? And then, secondly po, ano ba itong coronary artery disease? No, sasabihin sa atin ng doktor natin, meron po kayong CAD or sometimes coronary artery disease, ang tawag po nila is ischemic heart disease. Or sometimes ang tinatawag po ng ibang doktor, CHD or coronary heart disease. So whatever it is, iisa lang po ang ibig sabihin nun. Meron pong problema sa ating mga coronary arteries. So ito pong proseso na tinatawag po nating atherosclerosis, ito po yung sa loob ng mga ugat natin, through the years, from the time we were born, nagde-develop po ang mga ugat. Ang problema lang po, minsan, nagkakaroon po ng mga deposit ng mga taba. And then lumalaki na po yung taba. Tumitigas, palaki ng palaki, nagpo-progress. And this process, ang tawag po dyan is atherosclerosis. So yung proseso po ng atherosclerosis is something like a general term. No? Hindi po yan ibig sabihin, may atherosclerosis ako, may sakit kagad ako sa puso. Pwedeng wala po sa puso ang atherosclerosis mo. Ang ibig sabihin lang ng atherosclerosis, merong bumabara, nagde-develop ng bara ang mga ugat po ng katawan natin. Okay, now, ano naman po itong coronary heart disease or coronary artery disease or yung iba pong mga doktor, as I have said, ang tawag po ay ischemic heart disease. Ito po yung atherosclerosis specifically nandoon po sa coronary arteries natin. So, pagka sinabi po natin coronary artery disease, meron daw akong CAD, meron daw akong CHD, meron daw akong IHD. Naku, isa lang po ibig sabihin, no? Yung coronary arteries po natin, nagkakaproblema. Meron pong nagiging bara. Ano po bang hitsura ng bara talaga, no? Let me show you kung paano pong nakikita yan. Ayan. Okay. So, hinati ko po longitudinally yung isang artery. Ito po yung isang ugat. Makikita niyo po dito sa kukuha ho ako ng isang pointer. Ayan. Makikita niyo po dito, ito po yung ugat natin talaga. Ito po yung labas niya. This is the intima or ito yung sa loob ng ugat. Now, ito po yung chamber ng ugat. Diyan po nagfo-flow yung blood. Okay. Ang atherosclerosis po, meron kami tinatawag sa cardiology na timeline, no? Atherosclerotic timeline. Ano pong ibig sabihin yan? From the time that you were born, malinis ang arteries natin, syempre. Pero as we grow older, makikita po natin na posible palang magkaroon ng mga bara ang mga arteries natin, kagaya po nito. Masusurprise po kayo. Kasi yung iba nagsasabi, magkakaroon ako ng sakit sa puso, no? Siguro pag 30 years old na ako or 40 or 50 years old. So saka na ako mag-aalis ng mga cholesterol, mag-enjoy muna ako sa mga kinakain ko. Hindi po totoo yan. Kasi meron na pong dalawang research study na matagal na pong na-publish, mga 1980s pa. Yung pong pangalawa was 1997. Sinasabi po nila, gumawa po sila ng autopsya, no? They did some autopsy sa mga bata po, mga infants. Alam niyo po ba kung ano nakita? Ang nakita po nila, dito po sa pangalawa, dito po sa pen ko, no? Makikita mo parang meron ng tumutubong bara. Kumakapal na tong area na to. Pero makikita niyo po, medyo malabo ng kaunti. Pero during the first decade actually, ang totoo po, base sa dalawang research studies na sinasabi ko, dito po sa first decade and as early as 2 years old, pwede na po tayo magkaroon ng tinatawag na mga foam cells. foam cells. Yung parang foam, parang sponge, no? Ano po yung foam cells? Mga taba po yun na nagde-deposit na dito sa mga area na to, dito sa layer ng ugat na to. Okay? So, from 2 years old, pwede na tayo magka-foam cells. Hala, mataba na nga yung bata. Sige, i-vitamins mo pa. Kain ka lang ng kain dyan, anak. Sige lang, kain ka lang ng kain. Ang hindi po natin nalalaan, nagde-develop po ang foam cells from 2 years old. And then, up on the end, no? Doon po sa bandang dulo ng first decade natin, 8 years old, 7, 9, 10, makikita po natin, nagkakaroon na siya ng fatty streaks. Pag hindi po maganda ang ginagawa ng mga bata. Alam niyo naman po ngayon, ang mga millennials ngayon, ang mga bata ngayon, palaging sa computer na lang. No? Palaging nakakalimutan na natin turuan siguro ng mga napakaganda nating laro nung tayo'y mga bata pa. Naku, palagi ho akong natatalo sa tumbang preso, ano yun? Jumping jack, gano'n, etc. Taguan pong. Yan, naku, palagi patintero, yung mga yan, palagi po akong nahuhuli dyan. Pero anyway, napakaganda po nung larong yon. Kasi ngayon natin ma-realize na from 2 years old pala, oo nga, nagfo-form na pala ang foam cells. And then nagkakaroon ng fatty streaks. Kung hindi ho natin aayusin ang mga pagkain at aktibidades ng mga mga anak po natin, makikita po natin na from the second to the third decade, ibig sabihin 20 to 30 years old, naku, eto na ho, lumalaki na itong lumalaki na yung mga bara. Kasi ang foam cells nagiging fatty streak, tapos lumalaki po, tumataba, nag-grow po yung bara. And kung talagang mahilig tayo sa exercise, perhaps etong bara na to will stop growing. Pero pagpabaya po tayo lahat, no? Pagpabaya po tayo, nako, tuloy-tuloy po yan. End of third decade, imagine at 30 to 35 years old, pwede ka nang magkaroon pala ng atheroma. Ano po ang atheroma? Ang atheroma po is a well-established bara. Ibig sabihin, talagang bara na po siya. And you can see here na medyo malaki na po, medyo thick na siya. And then, kung pabaya pa tayo, wala pa tayong pakialam, no? Kasi wala naman tayong nararamdaman siguro. It will develop into a plaque. Ito pong plaque na to, ito po ang talagang bumabara na kagaya po neto. So from the fourth decade, pwedeng well-established na po ang bara sa ugat natin. Well-established na po ang coronary heart disease. So tanong sa inyo, Doktor, ano po bang mga edad pwede ako talagang magka-heart attack? No? Ako, I would say towards the end of the third decade. Perhaps, no? Marami na pong pwedeng magkaroon ng heart attack towards the end of the third decade. So mga 35 years old and above. I can only remember, no, since I was a student, no, medical student, isa lang po talaga ang nakita ko talaga nag-heart attack at 19 years old, no? Imagine that, 19 years old lalaki. Nakita ko po siya, 30 years old na siya, 10 taon na siya na-atake sa puso, mahina na po ang puso, kawawa naman. Then I asked him, ano ba, bakit ano bang ginawa mo? Did you do anything? Dok, wala po. 5 years old po kasi tinuruan akong magsigarilyo ng chewing ko. And then nagustuhan ko po, kaya pa konti-konti. Pero at 10 years old, Dok, nakakalampas isang kaha na ako. Ayun, there you are. 10 years old, isang kaha, everyday. My golly, at 19 years old, nag-heart attack na siya. Nag-MI na. You can see how important, no, that we should start taking care of our health from the very time that we were born. From the time na lumalaki tayo, kailangan medyo...
Oh, get your diaper.
Okay. So ayan, ganyan. Tuturuan natin ang mga anak natin to get their diapers para kumaano talagang gumagalaw. Pero we have to watch them, their activity, and the food that they eat. Mamaya, i-ano natin yan, pag-uusapan natin yan. So, ayan. This is what we call the atherosclerotic timeline. Okay? So, ang atherosclerosis can also affect other organs. Sabi ko nga kanina, atherosclerosis hindi lang para sa puso. Pwede ba rin sa brain? Makikita nyo to. Pwede kang magka-stroke because of atherosclerosis. Pwede kang magkaroon ng sakit sa paa because of atherosclerosis. Kaya yung mga ibang pasyente, nakikita natin, napuputulan pa ng paa yung iba. That's the worst scenario. Pero yung iba, nagkakaroon lang parang numbness, nagkakaroon ng parang pain, or parang needle pricks na sensation sa dulo ng paa nila, no? Beware, pagka may ganun, baka nagkakaroon kayo ng atherosclerosis sa paa. And of course, yun sa heart, yan ang topic natin. Ang atherosclerosis sa heart is what we call coronary heart disease again, or CAD, or coronary artery disease. Pwedeng mag-produce siya ng angina. What is angina? Angina is specifically chest pain na nanggagaling ang origin is coming from the heart. Wala nang iba. So if we say angina, sabihin sa ng doktor mo, meron ka ma'am, meron ka sir na angina. Oh, nako, mayroong angina, chest pain pala na nanggagaling sa puso. It can also develop into a heart attack. Pwede tayong mag-heart attack sa CAD. And then of course, sudden cardiac death. No? Ibig sabihin, ang ganda-ganda ng activity ng masayang-masayang isang tao. Ang ganda-ganda, bigla na lang bumulagta. And then that's it. Nag-heart attack pala. Nako, ano ba talaga yung mga risk factors na yan sa nagbibigay ng coronary artery disease? So this is just the risk factors talaga, no? Age by itself. Dalawang klase yung risk factors eh. Yung isa, we cannot help it, no? Talagang wala na tayong magagawa. Yung isa, we can still do something about it. Okay? So, yung mga wala na tayong magawa, ay nako, edad natin. Kasama na ako dito, syempre. More than 45 years old, no? Pero sa mga babae, more than 50 years old. Do you know why? Because of your hormones. You females are quite unfair, no? Unfair kayo. Kasi meron kayong estrogen, meron kayong hormone. It is actually protective. No? Medyo may protection yan sa inyo for developing heart disease. Kaya 55 years old kasi after menopause, pwede nang mag-develop yung pwede mang mag-develop yung coronary artery disease mo pagkapabaya ka sa sarili mo. So, ang mas matagal ang onset ng CAD sa mga babae. And then sex, male versus female, no? Unfortunately, pagka tayo ng sex, when we talk about sex, mas maraming problema sa puso sa mga lalaki. Tuwan-tuwa naman ang mga babae dyan, no? Kasi siguro, padre de pamilya or ang mga lalaki by nature, mas madaling magproblema or mas maraming ginagawa, gano'n, etc. So, mas maraming stress. Okay? Etong race na to, medyo may ang race, medyo may factor din yan, pero hindi masyadong pinapansin. Pero yung mga Italiano, mga ganyan, mga Caucasians, mas marami nagde-develop ng heart disease, no? And then family history. This is very important kasi kapag medyo meron sa parents ninyo or mga uncles or first degree, second degree relative na may sakit sa puso, ingatan na natin ang sarili natin kaagad. Kasi ang sakit sa puso, gaya ng diabetes, gaya ng hypertension, high blood, lahat yan nakukuha sa pamilya, na ipapasa. Merong chromosomal aberration yan. No? So talagang hindi tayo makaligtas dyan. These are the risk factors that we cannot help it. No? What about those risk factors naman na pwede nating ayusin? Okay? Yan ang mga pwede nating ayusin. High cholesterol, no? Ang sarap kayang kumain ng lechon. Ang sarap kayang kumain ng balat ng chicken. Okay? So, kaya lang, you have to watch out for your cholesterol. No, high cholesterol can give you coronary heart disease. Smoking will add another 45% chance that you will have CAD. High blood pressure, yung mga high blood dyan. Pagka nag-normal na, karamihan sa atin, inihihinto na. Kasi, ang gamot. Kasi, normal na ang blood pressure ko, doctor eh. So, ihinto ko na ang medicine ko, which is wrong. No? Diabetes, obesity. Ito yung mga hirap na hirap tayo magpaliit. Mamaya, meron akong interesting slide about obesity. Pero, we have to try to do something about obesity, no? And then alcohol. Totoo, no? Sasabihin sa inyo iba, alcohol is good for health. Yes, in very small amounts, no? Sa mga lalaki, sabi ng ibang research, mga two shots a day is okay. And then sabi ng ibang research, for females, sa mga babae, 1 shot a day of alcohol is also okay. So, okay lang pala. Ngayon, kailangan nyo lang malaman kailan na masama ang alcohol. Okay? Didiscuss din natin mamaya. Physical inactivity. Pagod na tayo eh. Pagdating ng bahay, naku, wala akong gana mag-exercise. O kaya, minsan, pagka lumalabas tayo dyan, maiinggit tayo. Naku, sana meron ako, nakita mo yung fitness first, for example, ang daming magagandang makina. Naku, sana wish ko lang meron akong ganyan sa bahay para everyday mag-exercise ako. Ayun, nagkapera yung taong yon, bumili ng pang-exercise, hindi naman ginagamit, di po ba? Kaya usually yung mga ganyan, may mga complete gym na kayo sa bahay pero hindi pa rin kayo nag-exercise. Pero exercise is very cheap. Hindi nyo po kailangan ang makinarya. Hindi nyo po kailangan ng mga machines para makapag-exercise ng tama. And then lastly, stress. Ito pong napakahirap i-manage, no? Yung stress. Pero ma-manage po natin yan. Kaya natin lahat yan mentally, no? Kailangan sa stress kasi dapat medyo time management at saka kailangan talagang decided ka na talagang ayusin ang schedule mo para hindi ka masyadong stress. Okay? So, let's go to number 1. Etong kaya nating i-manage, no? Cholesterol. Cholesterol, of course, is fat. Everybody knows about it, no? Kailangan niya ng katawan natin. In fact, the brain gets its energy from cholesterol. It circulates in the blood. Ang problema, pag dumami na, tumaas na ang level ng cholesterol mo, saan pupunta yung excess cholesterol? Magdi-deposit yan sa arteries ng mga ugat natin. Magkakaroon tayong atherosclerosis. Pangalawa, pwedeng pumunta sa liver. Kaya ang dami-dami nating mga fatty liver ngayon. Pag nagpa-ultrasound ka, mga pasyente ko, siguro I would say 95% will have fatty liver. I don't know if it is just coming from the radiologic technique, no? Pero fatty liver, so sometimes we have to listen, no? Baka sumusobra ng cholesterol level natin. And then, ang problema sa cholesterol, etong last na to. Nakikita niyo ba to? No symptoms, sorry for topo error, no? No symptoms until the time na magka-atake ka na sa puso. That is the problem. No? That is the problem. Kaya yung iba sa atin, kain lang ng kain. Yan, bigla na lang mag-heart attack. So, it is very quiet. Cholesterol is very quiet. Siguraduhin natin, chine-check natin yan. Meron po tayong tinatawag na good and bad cholesterol, no? Madali lang po. Bad cholesterol, ibig sabihin, hindi natin gustong mataas ang level sa katawan natin kasi bad sila eh. Tatlo po yan, yung LDL, VLDL at saka triglycerides. Yan po yung mga bumabara, yung mga nagka-clog sa arteries natin. And then, yan po ang bad cholesterol. Ito po yung good cholesterol, yung HDL. So pag narinig nyo po, Doc, ano bang HDL ko? Yon. Ibig sabihin, tinatanong mo kung ano yung level ng good cholesterol mo. Bakit? Kasi magandang ginagawa ng good cholesterol ng HDL. No? In fact, ang HDL, nilalabanan niya ang LDL para wag masyadong tumaas. Pero usually, natatalo siya. So, ang HDL talaga, the higher, the better. So, yan ang tandaan niyo po. Minsan natatakot yung ibang pasyente ko, Doc, meron akong letter H dito, meaning high sa blood test ko. Tinignan ko, yung pala HDL. So, sabi ko, dapat magpa-party ka pa kasi tignan mo naman ang HDL level mo, ang taas-taas. So, ang Ang bad cholesterol, ayaw natin yan. It should be low. Dapat low ang level when we get our blood examinations. And then HDL, good cholesterol, dapat high. Obesity related to cholesterol, no? Ang dami sa ating overweight. Do you know that in the United States, ang survey in 2020 is about 67% of their population are actually obese. 67%, no? Pag sinabi nating obese or overweight, yan yung mga 10 to 30% above our normal weight. So pwede tayong mga 10% or less, no? Pwede yan, pwede yan. Pero above 10% in excess of our body weight, overweight na yan. And then, ang problema, pag obese ka or overweight ka, you will have at least 2 times, up to 6 times the risk of developing a heart disease, no? Pwede ka magka-heart attack 2 to 6 times higher compared to those people na medyo sexy, na hindi sila obese or hindi overweight. Ito ang tandaan nyo. Gusto kong matuto tayo dito no? Tignan nyo tong level na to, no? Normal waist to hip ratio. Oops, pag uwi ninyo or mamaya pag nasa bahay kayo, sukatin niyo ng tape, kuha kayong tape measure. Sukatin niyo yung waist nyo. Ang waist, wag kayong mandadaya walang dayaan. Ang waist is dun sa level ng umbilicus. Naku, wala na tayong magawa pagka nakalaylay yung umbilicus, yung pusod. So anyway, yung sa umbilicus, yung sa pusod, doon ang waist. And then ang hips dito sa sa dalawang pinaka lateral most portion ng etong hips natin. Okay? So yan ang normal. Dapat pag babae less than 0.85 pag ni-ratio mo yung dalawa, dinivide mo yon. Pag lalaki naman dapat less than 0.95. Now, meron kami sa medisina na tinatawag namin pears and apples, no? Ano ba yung pears and apples na yan? Pears obesity, apple type. Ito lang yan Ang ibig sabihin lang yan kung anong klase ng taba. Okay? So, ito yung pears and apples. So, titignan na lang natin ang sarili natin. Hindi siguro tayo lahat ganito, no? Pag sinabi mo yung apple obesity, parang ganyan, parang mansanas, no? Ito 'yon, no? Ito yung apple shape. Ito yung lalaking to, yung malalaki ang tiyan, malalakas mag-beer. Ayan, so apple-shaped obesity. And then yung pear-shaped obesity, ayan yung eto, no? Medyo umano below the hips, so ayan, no? Makikita mo yan. Yung type ng obesity na yan, that is pear-shaped. So whatever you have, no? Whether meron kang pear-shaped obesity o kaya meron kang apple-shaped obesity, increased risk kayo. Pero between the two, sasabihin mo ba, Dok, alin ba ang mas masama dyan? Yung apple shape. Mas higher ang risk compared to the pear shape. Bakit? Usually, in this type of obesity, dito yun sa tiyan, sa tummy, akala mo under the skin lang yung fats na yan. Hindi. Usually, in apple shape, research findings have seen a lot of fat deposits dun sa mga internal organs natin. So, ibig sabihin, dun sa loob ng tiyan niya, doon sa aorta na doon sa stomach niya, sa mga intestines niya, naku, nababalot ng maraming fats. That is what we call visceral fat. And that is more extensive and it's more dangerous sa puso natin compared to the fat that we see in the tummy. Secondly, kaya mas maano ang apple shape, they found out na ito palang taba na to sa stomach natin, hindi lang pala taba yan. Parang organ na yan. So ang people, yung mga tao na with apple shape obesity, yung malalaki ang tiyan, hindi lang pala masagwan tignan, Yung tiyan na yun mismo, parang nagiging isang organ na, masamang organ. You know why? It secretes a certain protein na nag-i-increase ng process ng atherosclerosis. So, ibig sabihin, meron palang, pag malaki na to, nagde-develop yung mga receptors dyan, may nagde-develop ng mga lugar dyan sa fats na yan, na nagsisecrete siya ng hormones na masama sa katawan natin, na mas mabilis tayong magkaroon ng mga bara-bara sa ugat. So, yun lang pala. Akala natin dati, ang pangit lang tignan, pangit naman talaga. Kaya ako hirap na hirap ako magpaliit. No, minsan sa litratuhan na lang, nag-i-inhale na lang ako para hindi makita na meron pala akong apple-shaped obesity. Pero yung pala, nakakatakot din pala yung tummy na yan. So that tummy is now an organ, no? They studied this, hindi nila nakita na mataas ang receptor content niya. Meron daw but very minimal. So between the two, yun ang reason kung bakit between the two types of obesity, no, apple shape ang mas mataas ang risk. So siguro wag niyo naman sabihin sa akin na nako, okay lang pala akong maging mataba dito, wag lang sa tiyan. Both of them are at high risk. Mas mataas lang nga ang risk ng apple shape. Okay. So, eto pang pangalawa. Sarap matulog. We should have 7 or 8 hours of sleep every day, and that is healthy. No? Kaya lang, physical inactivity, it is not just sleeping. Minsan, gigising tayo, sabihin natin, gusto kong mag-exercise, no? Pero mamaya, makita mo yung kape mo, sarap ng kape. So, iinom ako ng kape. Tapos nakita mo may tinapay, naku, magto-toast bread ka na, ayun na, tuloy-tuloy na. Makakalimutan mo na ang exercise. So, this is actually what most of us are doing, no? This is what's happening every day. No, paggising mo, sarap. Oh, Dok, nag-exercise naman ako. Sasabihin sa aking mga pasyente, naggaganon ako. Oh, okay na yan, Dok, di ba? Pataas pa nga eh. Meron pa nga pa-side eh. At saka meron pa nga pababa eh. Gano'ng katagal mo yung ginagawa? Dok, siguro mga 10 beses na ganyan. Naku, sabi ko, hindi yan exercise. Pwede mong gawin tuloy-tuloy pero tagalan mo. So that is it, no? It's not just exercising, it is doing the proper exercise that will help. Ito pa, cigarette smoking talaga. Naku, ito ang mahirap i-convince ang tao, no? Cigarette smoking can increase your blood pressure. Naku, kaya yung iba, hindi namin ma-control masyado ang blood pressure. Kasi, bakit? Kasi sigarilyo, ayaw talagang itigil. And then, it can decrease HDL. Again, ano yung HDL? Good cholesterol. So, ang smoking by itself, no, binababa pala niya ang HDL, ang good cholesterol. And then, it can directly damage the arteries and blood cells and can increase the risk of heart attack. Bakit? Bakit kaya yung i-damage? No? Smoking can damage your arteries and blood cells and can induce a heart attack. Bakit? Because that smoke contains more than 4,000 chemicals. So yung nililigarilyo ka, more than 4,000 chemicals pala yun. And then 200 of these chemicals are actually poisonous. Hindi siguro alam ng karamihan sa atin na yung cigarette na yan, meron niyang carbon monoxide. Ano yung carbon monoxide? Nakakita kayo sa mga sasakyan, yung lumalabas na usok na tambucho. Carbon monoxide yon. Nako, meron ang cigarette niyan. Merong carbon monoxide yan. And carbon monoxide and nicotine are the two most dangerous chemicals and most poisonous chemical from the cigarette smoke. No? Nahirap talaga yan. You know why? Yung cigarette smoking, yung nicotine can excite, no? Can stimulate an area in the medial hypothalamus. Ano yung hypothalamus? Ano yan? O ganito na lang. Merong isang portion sa brain na ini-stimulate ng cigarette smoking ng nicotine. Kapag ini-stimulate na yon, ang effect ng area na yon, you are happier. Ibig sabihin, mas masaya ka. No? May positive effect, nagiging mas masaya ka. And that is the reason why cigarette smokers doesn't want to quit. No? There has been several. Pfizer have developed a tablet, no, against smoking. No? They have developed this cigarette, pero failure din. No, wala rin, tuloy-tuloy pa ng pagsisigarilyo. Because smoking is something na it's a habit. So what is a habit? If you really don't want to stop smoking, you cannot stop smoking. So you have to be very, very sure at talagang motivated ka to stop smoking, to be able to stop smoking. So yan ang problema. Kaya motivation plays a big factor sa pag-stop ng paninigarilyo. Okay, so eto lang, nilagay ko lang dito kasi akala natin ini-smoke lang natin yung cigarette natin. Yung parang kala natin, handle natin. Kung gusto natin kalahati lang, tapon na. Okay, so we are smoking the cigarette. Yun ang tinatawag nila, smoking quote and quote. Actually, it's the other way around. Tayo ang hinahandle ng mga cigarettes na yan. No? It is not the other way around. Alcohol consumption, no? Sabi nila, 1 to 2 drinks is beneficial, no? Tama, totoo. Especially red wine. Because red wine, meron yung mga antioxidants, meron yung mga proteins na ang tawag namin doon antioxidants. Pag nakarinig kayo ng antioxidants, what does it mean? It means that it is a certain substance in that drink, no, pag napunta sa blood, nagkakaroon ng mga positive effects sa puso at sa arteries, no. Antioxidants, medyo neutralize nila yung mga waste materials sa blood, no. And then nagpo-produce siya ng magandang epekto sa puso, nire-relax niya ang puso, pati sa mga arteries natin, antioxidants, nagpo-produce sila ng relaxation. Okay, so maganda pala ang red wine. Pero don't overdo it. 1 to 2 drinks only, no? In large amounts, kita mo, lalo na ang beer, no, and whiskey, it adds fat. Yan. Kaya tingnan mo, makikita mo yung mga mahilig makipag-inuman sa labas ng kanto, sa mga kanto, ang lalaki ng tiyan nila, no? Kasi ang lakas mag-consume ng alcohol. Okay? So, mataas ang calories ng alcohol eh. Tinataas niya ang fats. So, mag-hypertension ka rin. Kaya ang dami ding nagkakaroon ng stroke during the time that they are drinking. So, 4 drinks per day, you end up with a gastroenterologist instead. Yung liver mo naman. And then, other people nagde-develop ng gastritis, tapos hyperacidity muna pala, and then gastritis, pag hindi na-treat, magiging ulcer. Ayan. Okay, so, and then the liver also medyo na-hurt din ang liver mo with a lot of alcohol. Okay, so, ang mga babae lang mag-ingat because this is a finer line for women. So, if we are allowed 2 drinks a day, you are allowed only 1. Okay, so mas lower. Okay, 33% of adults in general, 33% over 20 years of age are already hypertensive. So this is the data worldwide, no? 33%. So ang dami yan. Almost 1/3 of the population pala nag-high blood na. But in this 33%, no? 40% does not know that they are hypertensive. So that is the problem with hypertension. Ang hirap namang i-diagnose. Ang hirap naman because most of the time, we are having high blood pressures. High blood pressure of 140 over 90 or sometimes 150 over 90 pero wala tayong symptoms. And that is the problem. Hypertension can start. No, it can we have hypertension na pala pero hindi natin alam basically because of the absence of symptoms. Meaning to say, may high blood na tayo, wala pa tayong naramdaman. That is the problem. And that is the reason why 70% ng mga taong may high blood meron na itong tinatawag na hypertrophy. Ano yung ibig sabihin ng hypertrophy? Ang hypertrophy is thickening of the muscles of the heart. Ibig sabihin, tumataba yung magiging mas makapal yung muscle ng puso mo. Huwag kayong matakot dyan sa hypertrophy. No? This is a risk factor, pero huwag kayong matakot. As long as you control your blood pressure, even if you will have hypertrophy, you are safe. Okay lang yan. In fact, some types of medicines can reduce hypertrophy. Ibig sabihin, no, merong mga ibang gamot na pwede pang ganito kakapal. For example, yung heart mo. After 2 years of taking the medicine, controlling your blood pressure, bababa na yan. No? Bababa na yan. Sometimes it even goes down to the normal thickness of the heart muscle. No? So, don't get scared of hypertrophy. Pero at least pag sinabi sa'yo ng doktor mo, meron kayong hypertrophy dito sa 2D echo mo or sa ECG, yan ang maiisip mo na makapal. Mainly because of hypertension. Okay? Now, ang problema sa hypertension, pinakakapal niya yung arteries. And then also at the same time, yung bara na sa atherosclerosis, mas nadadagdagan siya with hypertension. Kasi hypertension, ang taas ng blood pressure. So ang taas ng flow, yung velocity ng blood flow sa loob ng mga arteries mo, ang bilis, ang taas. So it can cause yung tinatawag namin sa medicine na shear stress. So nai-stress yung loob ng ugat ng puso mo, nagagasgas siya, nagagalusan siya. So lalong lumalaki, nagkakaroon ng mga bara. So yan ang problema sa hypertension. Now, ang problema, it can reduce yung flow ng blood papunta sa puso. Bakit? Kasi ang taas ng pressure eh. So mataas ang pressure, merong resistance sa blood flow. Doon sa mga pandilig natin sa halaman, yung hose na yan, pag inano natin, di ba? Pagka pinisil natin ng konti, mababawasan yung blood flow, pero mas malakas ang pasok, mas malakas ang labas ng tubig, di ba? Ganon din ang nangyayari sa heart. Bumababa ang flow ng blood, pero ang taas ng tension. So it's not good. We really have to control yung hypertension na yan. Then syempre mga complications siya, pwede tayong mag-heart attack or ACS. ACS, yan po yung bagong term sa heart attack. Dati ang tawag namin dyan, MI. Nung araw, MI, or heart attack. MI, myocardial infarction or heart attack, simple term. Now it's ACS. Then we can have a stroke sa brain. Then we can have kidney disease. Meron mga tao, walang ibang sakit, high blood lang. Ayun, nadadialysis na because of poorly controlled hypertension, hindi kontrolado high blood nila. And then peripheral artery disease, yung pong mga pwede din tayo magkabara dito sa mga paalam po natin. Okay? So hypertension. The other thing is diabetes. Iyan po ang isang sakit na namamana rin, gagaya ng hypertension. Okay? So, ang diabetes hindi maganda because at any given cholesterol level, kasi mayroong mga iba nagsasabi, Doc, diabetic ako pero ang ganda naman ng cholesterol ko. O, di ba? Okay na yan? Hindi. Pagka diabetic ka, at any cholesterol level, whether normal ang level mo or hindi, pag hindi kontrolado ang diabetes mo, you will have 2 to 3 times higher risk of having a heart attack or stroke. Okay, so it is not enough, hindi sapat na i-control lang natin ang cholesterol level natin. Kailangan i-control din natin ang sugar level natin, siyempre, 'di ba? Now, i-compare mo ang diabetic na tao, non-diabetic, mas mataas ang heart attack dito sa diabetic. Okay? And then pag diabetic ka, 80% namamatay talaga sa heart attack. Okay, so even the risk nung sudden death, yung sudden heart attack or basta sudden death, yung bigla na lang bumubulagtak, for a diabetic, is the same as those people na nag-heart attack. So, yung pala, pagka-diabetic ka, parang the same din ang risk mo na magkaroon ng sudden heart attack dun sa taong nagkaroon na ng heart attack dati pa. So talagang medyo hindi maganda ang diabetes. Ang tawag nga ng mga cardiologists dito is coronary artery synonym. Kumbaga sa parang synonymous to coronary artery disease. Na pag sinabing meron kang diabetes, para ka na rin merong coronary artery disease. Pero nako, huwag niyo nang isipin yan. Huwag kayong matakot dyan. You just deal with the diabetes if it is present sa inyo. Okay. Medyo malabo, Pero ito yung nakita ko kasing magandang i-express what is stress, It is usually work-related, Yung stress is usually work-related, It can produce insomnia, Minsan nagtataka kayo, bakit ako kaya hindi makatulog? Yung pala merong inaalala. It can produce depression, anxiety, digestive problems. Ito, merong yung nagbo-bloat kayo, nagkakaroon kayo ng indigestion, that can be from stress. And then you can have heart disease, syempre. Okay, so nasabi ko na yan. And then it can even produce obesity. Because why? Stress can produce depression, no? So pag depressed ka, parang makakain na lang nga. Maraming ganyan eh. No? Pagka may problema, kumakain na lang. So it can produce obesity. And then, etong pinaka-importante, lalo na ngayong time of COVID, stress can reduce immunity. Kaya nagtataka siguro tayo minsan, ang laki naman ng katawan nung taong yun, no? Ang laki naman ng katawan. Lagi nakita ko, nag-exercise dyan, gano'n, inom ng tubig. Pero naku, grabe, naging critical pa. Nagka-COVID, naging critical. Ito si Mang Ingo na, naku, andyan lang, palagi lang nakaupo. Yan, lakad-lakad lang dyan. Naku, nagka-COVID pero wala naman, nasa bahay lang, naka-recover kagad. So, immunity is not based on the body physic, no? It is internal, nasa atin yan eh. We can have low immunity, yan lang tandaan natin, if we are always stressed. So what do? We calm the mind and body natin and soul. Paano yan? Paminsan-minsan magpa-spa kayo. Social naman masyado si Dr. Spa, ang mahal-mahal naman magpa-spa. Di lang kayo, do something like gardening, no? Meditating, or upo ka lang dyan and then tignan mo lang yung napakagandang bulaklak na gusto-gusto mo and then free your mind. No, do anything, no? Or sometimes just listen to music, no? Listen to music. Don't listen to rock music because yung mga rock music na yan napag-aralan na yan, no? Sa England, Harvard University, nakakatuwa yung pag-aaral nila dyan Naglagay sila sa room ng mga halaman. Naglagay sila sa room ng halaman, 2 room. Yung isa, nilagyan nila ng tugtog every morning hanggang yung mga piano lang, mga violin, yung mga calm music. And then yung isa, nilagyan nila ng mga rock. Yung mga yung talagang nakakabingi, nakasakit ng tenga ng mga music. After 1 month, nakita nila, hindi nag-grow yung iba namamatay pang plant dun sa rock music. Pero yung iba, nandito sa in spite of dinidiligan, binibigyan ng fertilizer, dito sa kalmadong music, napakaganda ng tubo ng halaman. So music is something, no? It can de-stress us, no? So let us listen to our favorite music every day para makalmado tayo. Okay, merong mga businessman or merong mga tao na creative masyado. Yan ang strategy ko para ma-de-stress ako or mabawasan yung stress ko or para maging healthy ako. So, pinag-usapan niyan mga fast food division paano kung i-convince natin ng public na sexy pala ang heart attack? Baka pwede pa rin natin ma-convince sila sa fast food. But they don't need this advertisement or propaganda kasi lagi naman ng mga, in general, ang mga tao talagang nagpupunta sa fast food. Yung iba naman nakakaisip na never had a test or retest kasi nakalusot na ako sa first test ko, normal. Hindi na ako magte-test. Normal yung test ko nung year 2010 So, ganun lang iniisip mo, no? Or never had a test kasi siguro guilty ka. Baka you might expect na talagang mataas ang magiging resulta nun. And some people even hate doctors. Ayoko nga sa doktor, no? So, mahal-mahal mag-charge yung doktor na yan. Ayoko nga dyan. Tsaka kung ano-ano lang sasabihin sa akin. So, tumatakas lang yan. No? Hate ang doktor kasi tumatakas baka ma-discover nila kung ano yung mga problema sa health nila. And then never take medicines. No? Okay naman ako. I don't feel anything that is bad. No? It doesn't work. Now, my blood pressure is now normal. So, I have to stop my medicines. Now, before you stop, ask your doctors about it. Kasi usually, as a cardiologist, the first thing I do pag nag-normalize is to reduce the dosage or bawasan lang ang medicine but not stop the medicines yet. No, kasi medyo dangerous yan. And then some people go for herbals. No? Unfortunately, there are doctors and one of them is even running for vice president now. Sasabihin sa'yo, stop all your medicines. No. And then eto, bebentahan ka ng mga herbals or sasabihin sa'yo, herbals are better than what you're taking right now. That has never been proven. Just remember, this is just a statement. Herbals never had any research studies na talagang nakakagaling sila. Even dyan sa mga boxes ng mga herbals, no? Tignan ninyo, merong nakalagay na, ano ba nakalagay doon? No therapeutic claims, no? Oh, yan mga herbals na yan, lagi yan meron sa box, no therapeutic claims. Bakit? Kasi hindi nila sinasabi na nakakagaling talaga sila. Pero pag nag-advertise sila, nagpropaganda sila, parang maganda to sa diabetes, maganda to sa high blood, maganda to sa puso, magandang pang reduce, ganun, etc. No? Pero it's up to you to take those herbals. No, no one is stopping you. But just do not think na yun ang magsisave sa hypertension mo, diabetes mo, etc. Okay? So you can use that only as supplement. No? Okay? So yung iba nagdo-doktor-doktoran, no? That will not work. How do we really prevent heart disease, no? How do we really prevent heart disease? There are 4 rules that I would like to share, no? Preventing heart disease, number 1, very simple. Look before you eat, okay? Eat fruits and veggies, no? Every day, kung pwede, 5 servings pa nga, no? Marami silang minerals, very low in fat, high in fiber, vitamins, and then, of course, may mga antioxidants. Eat a variety of grain products, no? Grain products, yung mga wheat, mga ganon, mga oats, ganon. And then, of course, we're doing rice, di ba? So, that's included. So, if you want, you can add, no? Yung mga granola bars, ganon, oatmeals, ganon, pwede yung additional, no? Kasi ang mga oatmeals, especially, malakas magpa-reduce ng bad cholesterol. So that is also good, no, to eat other grains other than rice, no? Then choose non-fat or low-fat products. Mas masarap yung milk na full cream milk, di ba? Mas masarap yung lasa. Pero with regards to health, mas maganda yung low-fat or non-fat. Pwede naman ng low-fat eh. So pag nasanay tayo doon, much better for our health, no? Yung mga meat na less ang fats, yan yung mga chicken or mga lean cuts, no, mga fish, ganyan, mga maninipis ang cut, ganyan. These are the lean meats which are very very helpful sa health natin. Okay? So again, switch if you can switch to skim milk, mas maganda daw yan. Okay? So ayan pa, it goes without saying, i-limit natin yung mga pagkain na mataas sa calories, no? Ang sarap naman kasi ng milk tea eh. Dapat may milk tea ako every day. Naku, ang taas ng calories. Sometimes, merong isang milk tea shop na meron nakalagay na calories eh. Dapat nagbabasa kayo doon. Pero nakalimutan ko ano yung milk tea shop na yun. But most of them, hindi naglalagay ng calories. Kasi kung mapansin nyo, maraming calories, no, as high as more than 1,200 calories. More than 1,200 calories yun. No? So, bino mo, isang milk tea lang, more than 1,000 calories na. So, you can just imagine how bad would that be. Okay, so yung mga soft drinks, candies, and junk foods, all of us are eating junk foods. But if we can reduce the number of times that we eat junk food, much better, no? Lalo na yung chicken wings and Jollibee, ang sarap ngayon, bagong-bago yan. Pero if we can reduce this junk food, siguro once a week, twice a week, pwede na. And then exercise, ganun, etc. Okay, so eto sa fats, no? Wag na kayong mag-research sa mga fats, no? Basta tandaan nyo lang, saturated fat, no, masama. Basta may nakalagay dyan, saturated fat, masama. So pagka tumingin kayo sa product, whether drinks yun or pagkain, tignan niyo sa likod, saturated fat, 3%, wag na. No, mas pumili kayo ng walang saturated fat. Okay? Then ang salt, wag kayong masyadong maalat. No? Ang hirap naman magsukat ng 6 grams of salt a day. Wala namang nagluluto sa atin na mini-measure pa yung grams eh, no? Basta wag lang kayong mag-added salt most of the time. You will be less than 6 grams, no? Have no more than 1 to 2 alcoholic drink a day if you are a regular drinker, no? Okay, 2 drinks pwede sa lalaki, 1 drink pwede sa babae. Okay, so limit those food. Again, rich in cholesterol and saturated fat. Egg yolk. Ang sarap kaya ng egg yolk, no? Parang hindi kumpleto ang egg without the egg yolk. No? Pero egg yolk, sa studies, no, medyo, ano siya maraming nagtatalo sa egg yolk. But merong isang research na sabi, you can eat as much as 3 or even 4 eggs a week, no? So it will not impose any significant increase in your serum cholesterol. So mga 3 eggs siguro a week, not really very bad. Fatty meal and organ meat. Yan, iwasan din yan. Or ilimit lang. Paminsan-minsan lang mga steak. Masarap kaya. Okay, butter chicken. Butter. Yan, medyo, if we can reduce butter, no, including the desi ghee, the mga cheese, mga full cream milk, and then lessen your ice cream, lessen your bakeries, biscuits, patties, and then cakes, pastries, gano'n. I-lessen lang natin yan. We will be good. Sa cooking oil, no, inan ko na lang itong cooking oil kasi meron diyang mga itatanong talaga. Pag sinabi mo, eto, saturated fat, ay ayaw natin ng saturated fat talaga. No, okay lang sa atin yung MUFA or PUFA. Okay, so monounsaturated at saka polyunsaturated fat. No, ang olive oil is a very healthy oil. Pero hindi naman pwede sa lahat. So we can use canola oil or mustard oil. And then soybean oil, sunflower oil, okay pa rin, no? Okay pa rin siya. But take note, no? Some people would say otherwise. Pero based on the research studies na nakikita ko, palm oil is not good oil. Okay? So marami sa groceries ng mga palm oil eh. Okay lang if you want to try paminsan-minsan, no? But palm oil is not suggested by most nutritionists. Okay, so rotate the oils. If you really want palm oil, i-rotate mo. Minsan canola ka, minsan sunflower, minsan palm oil if you want. No, so that's a good thing to do. Okay, so yung pag nakarinig kayo ng oil, na fish oil, yan ang maganda. Yan ang healthy heart. So omega fatty acid or fish oil is actually equivalent to healthy heart. Okay, so whatever brand of fish oil mo, sige lang. Just go taking it. Number 2 thing in preventing heart disease, exercise. We can maintain our healthy heart. Exercise. It doesn't need to be a very expensive exercise. No, maski wala tayong let's just put on our sneakers, malambot or rubber shoes na and then just maski jog ka lang for about umpisahan mo muna ng 15 minutes and then progress to 30 minutes or 1 hour. Ang gusto ko lang sa lahat, no? When you talk about exercise, let's say, dati kayong hindi nag-exercise, tapos umpisa pa lang kayong mag-exercise, wag yung gawin kaagad na 30 minutes. You slowly improve, no? You slowly increase yung amount of time na nag-exercise. Mag-start lang muna kayo mga 10 or 15 minutes. Yung kaya nyo. Pagkakaya nyo 10 to 15 minutes, after 1 week, then go to 20-25 minutes. O after 2 weeks, 3 weeks, sabi ko parang hindi na ako pinapawisan dito. So increase nyo to 30 minutes. And then if you're doing 30 minutes, maganda na yon. Okay, so maintain a level of physical activity that is actually supposed to be equal dun sa food that you eat. So pagka medyo sobrang nakakain ka ng maraming pagkain, naku, dagdagan mo yung exercise mo, no? Okay? So exercise can serve several functions. Number 1, it can reduce the incidence obesity, no? Kasi binaburn mo yung fats mo yung subcutaneous fat mo, binaburn mo. So parang pumapayat ka talaga. Okay? So that's reducing obesity. And then ito yung maganda increases HDL. So nakita niyo naman yan. HDL, good cholesterol, tumataas pala pagka nag-exercise ako. So that's good. That's a positive effect. So it can lower again, ito naman yung positive effect. It can lower the bad cholesterol. Okay? Pwede palang pababain ang LDL. And then it can even help control diabetes and hypertension. If you try to look for 2 patients who are diabetics, no? Diabetic, nag-exercise, walang exercise. Alam mo, mas kontrolado ang diabetes ng taong nag-exercise. So this is really very, very important. Okay? So, exercise, mortality is reduced to at least 50%, no? For those people na lumalakad more than 2 miles every day. 2 miles, ang layo naman. So sabihin na lang natin, mortality, 50% reduction, 2 miles. So gawin natin kalahati, 1 mile. So at least 25% reduction in mortality. Ang importante, the message is, if we walk, we definitely reduce the mortality rate for heart disease, stroke, etc. Regular exercise can again also reduce by 50% the risk of heart disease, no? Particularly if we do it briskly, yung brisk walk. No, kasi yung iba, nagwo-walking ako, doktor. Pero ang walking na lang naman nila, naku, ganyan lang ang walk nila. Diyos ko, parang naglalakad sa ilalim ng buwan. That is not good exercise. So if you want to do walking exercise, do brisk walking. Okay. Now, for people who are inactive, they have a greater risk of having heart disease. As someone who smokes, ayun pala, maski hindi naninigarilyo, ganun din ang risk, mataas din ang risk. Parang naninigarilyo ka na rin. As those people who have high blood pressure or mataas ang cholesterol. Now, exercise can also reduce the chances of developing diabetes and stroke. I have seen some young patients, younger patients na diabetic ang mga nila, very active in exercise, and then 40 plus years old na yan pero hindi pa lumalabas yung diabetes. Pero napaka-strong family history ng diabetes. So, exercise can really affect diabetes. No? Blood pressure, maapektuhan din niya. Pero do you know that by regular exercise, blood pressure can reduce by as much as 20. So, if your usual blood pressure is 150, pagka nagre-regular exercise ka, that can be only 120 or 130 na lang. So that's a very big drop sa blood pressure just by doing exercise. So just walk, no? This is just the message for the past 3 slides, no? Just walk. You don't need complicated machines, no? Or you don't need to be in the gym for that, no? But if you enjoy being in the gym, go ahead. Walang problema. So as long as you do proper exercise. Okay? So, ito yung, this is about the moderate to intense activity kasi yung iba, hindi kaya talagang intense activity. Don't worry. No? Start slow. As I have said kanina, minsan mga 10 to 15 minutes starting point ka lang. For a few weeks ka mag 10 to 15 minutes. And then, increase mo after a few weeks to the level na kaya mo up until you reach 30 minutes. Because if you reach 30 minutes, that is moderate physical activity already. So that is okay na. Pwede na. So ang makakita kayo ng mga maraming writings or journals sa 2 hours of exercise per week, pwede na yan. 2 hours of exercise per week. Okay. Number 3 rule, no? Stop smoking now. Okay, so napakahirap magsabi yan. But napakahirap ding sumunod ang mga pasyente until the time they develop a heart attack. Saka na lang nila sasabihin, nga doc, sige, hinto na ako. So let us not reach that point na nagkaroon na tayo ng complication before we stop smoking. Okay, so if we stop smoking, within 1 year, magkakaroon ka na kaagad ng benefit, no? Magkakaroon ka na kaagad ng benefit. But do you know that it takes about 15 years for the quote-unquote full benefit or return back to normal? So ganun katagal yon. But 1 year of quitting, medyo nag-i-improve na yan. And then smell and taste actually improves within a few days. And then within 3 months of quitting, the smoker's cough can actually disappear in most people. In most people, of course, hindi lahat. Okay, so that is still a benefit of smoking. So stop smoking now, no? Ano lang dito. Kasi sabi dito sa cartoon na to, I'm prescribing a patch to help you quit smoking, no? Just put it in your mouth. Ang patch niya nasa mouth para hindi siya makapanigarilyo. So nakakatuwa lang na cartoon. Number 4 rule, cholesterol naman, no? Ito dapat medyo kabisaduhin niya ng kaunti, no? Para we will know how low our cholesterol would be. No, know your numbers. So desirable numbers for total cholesterol less than 200. So total cholesterol less than 200. So LDL dapat pala less than 100. So total cholesterol less than 200. Total LDL less than 100, oops, kabisado na kagad natin. Ngayon, pagka ang mga cardiologist nyo, ibababa pa yan ng less than 70. I'm sure about it. Kapag nagkaroon kayo ng talagang sinasabi nila high risk ka, nag-heart attack ka na, nag-stroke ka na, poorly controlled diabetes, poorly controlled blood pressure, we should reduce your LDL down to less than 70. So huwag kayong magtaka lang dyan. Pero in general, for the general population, less than 100 is okay. Okay na yan. And then let us increase our HDL to more than 40. More. Hindi to less this time. Bakit? Kasi HDL, di ba, good cholesterol kasi. Kaya dapat gusto natin yan mas mataas. Now, the triglyceride level, no? Triglyceride level should be less than 200. So, triglycerides pala, parang total cholesterol, less than 200. Less than 200. So, we now memorized, no? We now memorized the desirable numbers for cholesterol. Okay? Get routine test, no? The only thing worse, eto maganda itong nasa baba, no? The only thing worse than finding out you have one of these conditions like hypercholesterolemia, diabetes, heart problem, atherosclerosis, etc., is not finding out that you have it. So we have to know whether we have it or not. We have to know that we have high cholesterol, high bad cholesterol, or do we have high good cholesterol? That is what we want. Do we have high bad cholesterol? That is not what we want. We have to know it. So we have to test our cholesterol. So the benefit is 10% reduction of blood cholesterol produces a 20 to 30% reduction in heart attack. Yan. Okay? So, CHD means coronary heart disease deaths, no? So, pagka may 10% reduction pala tayo sa cholesterol natin, ayan, meron tayong 20 to 30% reduction in heart attack deaths. Okay? So, all of us should be tested, no? In fact, 20 years old and above, dapat nagtetest na. Pagka 20 years old and above, every 5 years pagka normal. Pagka abnormal yan, pag mataas, then it's after 3 months hanggang mag-normal. And then after that, every year, pagka 2 years na magkasunod na normal, then you can go back to the regular na every 5 years, no? Pero kapag after 60 years old, you medyo mas madalas na. So don't be surprised if your doctors, your cardiologists are taking your cholesterol very often. Okay, this is just, those are the rules, no? How to get a healthy heart, how to maintain our healthy heart. But this is thus the benefits, no? Stopping tobacco. Itong 4 na linya will stop cardiovascular disease. It can stop cancer. Kasi tobacco, pwede kang mag-mouth cancer, pharyngeal cancer, laryngeal cancer, esophageal cancer, GI cancer, no? By just taking tobacco. And then pwede ka mag-COPD. Yung bang worst scenario is kahit saan ka magpunta, meron ka ng dala-dalang oxygen. So we should not reach that stage. And then of course, oral health, no? Magkakaroon ka ng maraming tooth decay, gano'n, etc. because of tobacco. Diet. Itong diet, of course, pag hindi maganda diet mo, may heart disease ka, pwede kang magka-cancer, pwedeng pumasok ang diabetes mo, pwede kang magkaroon ng osteoporosis. Ano yung osteoporosis? This is parang yung density ng bone mo, parang parang konti na lang. So mas manipis yung bones mo. So prone ka na sa fracture. Ayan, minsan tumalon ka lang. Yung iba, umiihi lang, nadulas, nabalian na. So this is osteoporosis, no? So diet, no? High in calcium, ganun, etc. High in vitamin D and E, ganun, etc. So to make our bones really strong. And then diet, pag hindi maganda, oral health, naapektuhan din. Okay, physical activity can improve our heart, lessen the incidence of cancer, improve the control of diabetes or prevent the occurrence of diabetes. And then of course, improve our bones. Yung circulation sa bones natin mag-i-improve. So maski matanda na tayo, very strong pang bones natin. Of course, physical activity improves mental health. Napakarami ng mga depressed na tao these days, especially young people, no? So engaging them, no, asking them to engage in exercises or physical activity or physical programs will improve their mental health. Lastly, alcohol. Of course, alcohol can produce heart problems, no? Ang dami. Pwedeng mag-coronary artery disease, pero pwede yun sa mga muscles. Ibig sabihin, normal ang coronary arteries ng puso mo, pero ang muscle mo napakahina. Bakit? Toxic ang alcohol, too much alcohol sa muscle ng heart. And then it can start also cancer, the process of cancer. Of course, mental health is really affected by too much alcohol. So yan yung mga factors na yan. At saka kung saan sila nagkakaroon ng benefit or disadvantage. So how do we really maintain, no, a healthy heart, no? Eat good diet. Yun lang. Kagaya na sinabi ko kanina, good fat, no? Take good fats. Yun lang. If overweight, lose some weight. Do regular activities to at least 2.5 hours or on the average, based on several studies, 2 hours per week, pwede na. Okay? Ito lang yung recommendation ng AHA. Medyo mahirap sundan to. AHA is American Heart Association, no? Baka narinig yung AHA, yun ang AHA, no? So the recommendation is at least 150 minutes of moderate, not strenuous exercise, or 75 minutes lang ng vigorous exercise per week. Okay, so avoid sedentary lifestyle. Yung mga nasa desk lang dyan, naku, napakarami sa Qualimed dyan. Mula umaga hanggang hapon. Yung iba napakasipag, no? Pwedeng bigyan ng medalya, lumalampas pa sa office hours, nag-overtime, pero nasa desk pa rin, nakaupo pa rin. No. Alam nyo, you have to stand up and then stretch or parang just ilakad, kalugin nyo lang yung mga muscles nyo sa paa, gano'n, etc. Or do some exercises like this every now and then, no? Every now and then. So 1 minute, you should stand up para i-free mo rin yung mind mo. That is healthy. That is actually healthy. Because sitting down on your desk, no? From 8 a.m. to 5 p.m. or 4 p.m., no? Is actually sedentary lifestyle. So pag yung mga boss dyan, pabayaan nyo lang tumayo lang tapos ano-ano lang yung mga tao ninyo. In fact, you should encourage them na, uy, stand up a little bit. Kanina ka pa dyan. So lugmok sa trabaho. Okay, so to avoid this thing we call the sedentary lifestyle. So sedentary lifestyle is not present only sa bahay. Yung mga nakahilata lang lagi. Yung mga desk workers, nagse-sedentary lifestyle din yan. So, siyempre, tobacco, cigarettes, stop it. Avoid the use of alcohol. This statement is actually avoid the use of alcohol. So, we can have 1 drink a day, ganon, okay lang. Wag 1 drink, yung iba kasi 1 drink, 1 bottle. Yung 1 shot a day, kung gusto yung mga whiskey ganyan or whatever, beer, ganito no, may malaking away pagka beer Kasi sabi nila, 1 can a day, yan ang recommendation dati. 1 can a day, okay lang yan. No? Pero merong ibang nagsasabi na it should be only 3/4 of 1 can. Yung beer na yan. Yung iba nagsasabi sa akin, 3/4 of 1 can. Sayang naman yung 1/4. Okay, so bahala na yan. Just don't use it every day siguro. Okay, so excessive use of alcohol is really very bad. And then of course, daily monitoring of the blood pressure and blood sugar. So before you start your work, check dumaan kayo anywhere, no? Yung mga kaibigan nyo dyan sa mga ward, ganun, sa ER, whatever. Check your blood pressure every now and then. Okay? Ito ang wala sa mga libro, no? How to have a healthy heart. Sasabihin lang yan, cholesterol, no? Yung eating, avoid sedentary. Yan ang mga tinatawag na lifestyle modification. Pero what about sleep? You have to catch your Z's or sleep. No, catch your good sleep. No, 6 hours is okay as long as you add once in a while. But the recommendation is really 7 to 8 hours of sleep every day. That is what health is all about. No, healthy sleep 7 to 8 hours. Yun lang. Okay, so harmonize your health with music. Lagi kong inaano to, no, music is really a good thing. No, pagka ang pasyente ko toxic na toxic. Naku, miski nagda-drive ako yan. Naaalala ko, ano pa bang gagawin dito? What else to do? So parang nandoon pa rin yung stress, no? So what I do, nag-iisip ako pero mag-on ako ng music that I like, no? Something that you like. So nare-relax ako while thinking about what to do next for my patients. So that is also what you do. Let's say, problemado kayo, hindi mo nagawa to. Naku, hindi ko pa natatapos yung pinagagawa ni Dr. Angel. Siguro si Ryan ganyan at saka si Tin. Naku, hindi ko pa natatranscribe yung lecture or yung meeting last time. So nai-stress ka na. So listen to music while you're doing it, no? Listen to music while you're doing it. That will reduce your blood pressure, reduce your heart rate, no? Reduce your stress while doing your work at the same time. Okay, so next is take care of your teeth. Akala ng mga tao, yung maski hindi ka magsipilyo, will have a healthy heart. Nako, mali kayo. Kailangan malinis ang teeth ninyo para maging healthy ang heart ninyo. Kasama yan, walang biruan. Okay? So kailangan nagsisipilyo kayo. Do you know, have you heard of gingivitis? Gingivitis, that can produce an inflammatory condition also of the heart. No, yung gingivitis. Yung gingivitis, yan yung namamaga yung gums mo. Gingivitis. Okay? And then once in a while, or sa room ninyo, or in one room of your house, mag-aromatherapy kayo. It can reduce stress. No? This is really good. It can reduce stress. So aromatherapy is also good. Lastly, tips for a healthy heart, you have to have some good laugh. Yung iba, ano yan eh, biro tong boss na to. Parang boring naman or ang corny-corny. No? Sometimes, pwede ka na rin tumawa maski corny. So pagtawanan mo yung kakornihan ng nagjo-joke sa'yo, it can actually increase or improve blood flow by at least 20%. So this is actually based on several studies already. So you have to be a little bit happy. So, yan na. Okay? So, yung iba, binabaliwala ang joy, binabali ang konting biruan. But again, laughter is a good medicine. So, if you want to have a healthy heart, you want to have a healthy you, remember these words. Eat very well. Alam niyo na yan kung paano. Exercise once in a while. Okay, control the intake of alcohol. Alcohol, as I have said, hindi naman masama if you try to do moderate or lessen the amount of alcohol intake. And then, of course, basically, walang lusot. We have to stop smoking. We have to control our diabetes. We have to control our sugar. Hindi pwedeng, may gamot naman ako eh. Okay na yan. No. You have to know kung control ng diabetes mo or not. So that is very important. You have to control blood pressure. Okay? Then you have to lower down. Ibaba natin ang cholesterol level natin. Sleep adequately. Tama na yung Korean novela na yan sa gabi, no? Meron akong mga hindi talaga kasi inuulit pa yung crash landing. Diyos ko naman. Tuwan-tuwa sila, sobra silang excited na ikakasal na raw yung bida. Sabi ko, bakit naman pati yung pagkasal ng Koreano, bida pinapakialaman pa. You have to have good sleep. Okay? So, good sleep is one of them. Lastly, manage stress. And then lastly, something na nakakalimutan natin, and I have just said, laugh once in a while. So these are the words that I want you to remember. You have to instill in your mind and in your heart in order for you to have a healthy heart. Added to that, lastly, thing is heart disease or heart problem does not start at 30 years old. It doesn't start at 50 years old or 60 years old. It starts very early in life. But it's never late, no? It's never late. If we try to do this and follow these words and try to find time for mending these things, then we will have a healthy heart. So, iyan po. Yan po ang gusto kong ibigay sa inyo at sa lahat ng isipan ninyo at puso ninyo na hindi po kayo nag-iisa, marami po tayo, at lahat po tayo will have a healthy heart in the future. Okay, Loven, I think I am done with my lecture. Thank you.
Wow, thank you very much, Dr. Melco. No, bigyan naman po natin ng virtual clap si Dr. Melco dito po sa chat box. Grabe, Doc. Lahat ng pain points ay inyong natusok talaga ngayong discussion po ninyo, no? So,
tinamaan ba kita, Loven?
yes, Doc, lalo sa sedentary lifestyle. Very much
yeah.
guilty.
Okay.
Siguro daw kailangan sa Qualimed ng Zumba session kapag ka-coffee break para kahit papano.
Kung gusto ni Dr. Angel yan.
Yes, Doc Angel, baka
Dr.
naman.
Angel.
Ang ating Zumba session. Okay, so Doc, thank you very much sa pagbibigay po ng kaalaman at kadulubhasaan. Ngayon, Doc, dadako na tayo sa ating live Q&A. So, mangyari po sa lahat ng ating viewers no, na itype po ang inyong mga katanungan sa chat box upang makasali sa aming talakayan. So, Doc, ngayon, may mga nakita na ako kanina habang nagdi-discuss po kayo, sobrang active na ating chat box, nagsisend na sila ng questions. Doc, yung unang question na nakita ko, Doc, how about sunmig light po?
Sunmig light? Ikaw naman, yan ang isa sa favorite ko din. Sunmig light is okay. It has less calories. Okay, so it's better than the regular. Pero alam mo kasi, minsan, sunmig light, no? Ginagawa nating parang excuse for drinking more cans. Okay, so if you want less calories, yes, sunmig light is better. Pero wag mong gawing excuse para, uy, pwede ako maka 3 cans nito. Sunmig light naman to eh. So yun lang. Ganun pa rin. Pag mas marami, maski less calories, tapos marami naman, ganun pa rin ang effect.
Alright, Doc. So, ibig sabihin, drink moderately pa rin po, no?
Ganun pa rin.
Alright. Thank you, Doc, for answering. Next question, may clinic po ba si Doc Melco sa Qualimed? Yes po. No, later po, ipa-flash po natin yung kanyang clinic schedule. So, after po ng Q&A session.
Walang bayad yung advertisement na yan, ha?
Yes, wala, Doc. Okay, Doc. Next question is from Sir Ramon Abadilla, our COO. Doc, I have stopped smoking for more than 2 years, but nag-gain naman ako ng weight. Any advice on how to avoid the gain weight?
Oh, Sir Ramon. Bagay naman sa'yo, cute na cute ka pa rin sa current status mo pa rin eh. Kaya lang, napansin ko sa'yo, medyo madami na yung subcutaneous fat mo talaga, no? You have this, you're developing the apple pear. Ano lang yan eh, it's not just stopping smoking. It is also, the best way is, number 1, yung sa food intake, no? So, dun sa food intake, medyo baka gusto mong i-add na rin, everybody can do it, na increase your water intake. Kasi kapag let's say nag-increase ang water intake mo, medyo parang nababawasan yung craving mo for food, as well as it's very healthy, no? Yung hydration. And then of course, exercise. Yun lang. Yeah. And then, I would expect you, Sir Ramon, baka makita na kita nagja-jogging dyan sa may Altaraza.
Thank you, Doc. Thank you. Thank you. You take the advice.
Alright. Doc, may follow-up question po si Sir Ramon. Doc, is coffee good for the heart?
Yes, sir. Sir Ramon,
Oh,
coffee is
okay.
good for the heart. Pero may study sila sa dyan, sir. It's really controversial as of now. But walang controversy for at most 3 cups a day. Kasi that can, coffee can increase your heart, it can increase your heartbeat. No? Tapos, in excess of 3 cups a day, parang nagiging, na siya, na-stimulate na yung, meron kasi sa katawan ng tao, meron yung sympathetic system. Sa nerves yun eh. Yung sympathetic system nagpapa-increase ng blood pressure, nagpapa-increase ng heart rate, tapos nag-i-increase ang atherosclerosis din, nag-i-increase ang deposition ng ano. So we don't want that. So 3 cups, okay lang. Okay lang, why not?
Thank you. Thank you, Doc. Thank you.
Okay, Sir Ramon, maximum of 3 cups. Okay, so we will watch Sir Ramon sa kanyang pagtimpla. Okay, thank you, Doc, and Sir Ramon for the question and for answering that. May question po tayo, can we have copy of the presentation? Yes, definitely. Meron po tayong kopya niyan sa ating official Facebook page and YouTube channel. So later, we will flash on the screen. Another question, Doc, no, about the oils. May mga question dito. Coconut oil po. What about garlic oil?
Coconut oil, no? With regards to coconut oil, this is a controversy. It's really very controversial. If you read research studies galing sa America and Europe, they will say coconut oil is bad. Pero sa Pilipinas, they have studied it sa ano ba yung DOST atin. Basta there is a local study in coconut oil and it's good. Maganda daw. So what do? We use yung mga virgin coconut oil. We can take it. Why not? No? Pero wag naman yung in excessive amounts again. So it's not just the type of oil, or it's not just the amount, the thing that we drink or we take. It is also the amount that we use. Wag lang sobra-sobra. Okay? Yung garlic oil, Loven, this is good, ha? Garlic oil is good. Kaya lang ang problema lang dyan, if you cannot use it in cooking. No, kasi medyo hindi daw maganda, sabi nung commander sa bahay. Hindi rin maganda if you use it sa cooking.
Ooh,
Okay, but garlic oil, pwedeng pa yung ilalagay-lagay mo lang sa it's like olive oil. No? So, paminsan-minsan lalagyan mo ng olive oil, gano'n, etc. So, and it's a little bit bitter daw. So, medyo hindi nila masyadong nagagamit. But it's good. Okay yan, garlic yan eh.
Alright, Doc. May aftertaste po siguro, no, yung garlic oil. Okay.
Yes.
Sige, Doc. Thank you for answering that. Before we proceed on the next question, update ko lang, ang dami nag-send ng virtual clap. Sobrang nag-enjoy sila, Doc, sa inyong discussion. Thank you, Doc. Thank you, Doc. Very engaging lecture and encouraging. Thank you, Doc. So, okay. So, next question po natin. Ito, Doc, medyo mahaba itong kanyang question. Doc, nakakatulong po ba talaga ang pag-inom or paghalo sa inumin ang apple cider vinegar upang bumaba ang cholesterol level ng katawan? I'm already 47 years old. Gaano po kadalas dapat magpagawa ng mga cardio-related examinations like ECG, 2D echo, etc.?
Okay, yung sa first question niya. Yes, maganda ang apple cider. And in fact, there have been a few studies na hindi ko pa na-prove yan in research studies, no? Wala pang research po yan sa apple cider. Nakakatunaw daw ng gallbladder stones. Kaya yung mga pasyente ko, may gallbladder, naku Doc, mag-apple cider na lang ako. Yan, hindi na ako magpapa-opera, ayoko magpa-opera. Merong mga nagsasabi sa akin na tunaw daw sila. No? But again, hindi pa po talaga, talagang hindi po talaga gumawa yan sa medisina ng research study about apple cider. The other problem lang po sa apple cider is yung acidity niya. Kasi po maraming nag-hyperacidity, maraming sumasakit ang tiyan or nag-bloated sa apple cider. So, why not? Use it, no? Drink it. I-dilute nyo lang with water, syempre. Tapos, use it. Wala pong problema. But, once na nagde-develop kayo ng GI symptoms like bloatedness or medyo pwede nyo na pong bawasan or alisin.
Okay, Doc. Yung sa next question
Ayun,
niya,
the
Doc.
next question niya
Mhm.
pala, 47 years old. At 47 years old, you can do a baseline study, baseline test, no? So magpa-test ka kagad ngayon. Pagka may abnormality, no, 47 ka pa lang that's still not old. So pag may abnormality, yung abnormality na yung sundan mo. So i-test mo yun either 1 week 1 month, pero ang ano ko is 3 months, no? So i-study mo, i-test mo ulit siya for 3 months kung ano yung abnormal. Now, kung lahat naman normal, you can choose. You can do it every 5 years or you can do it every 2 or 3 years. It's up to you. Pero kung ang lifestyle mo rin, medyo alam mo sa sarili mo, it depends kasi sa activity mo na medyo baka at risk ka, medyo sedentary ka ng konti, tapos mahilig ka sa mga taba, no? Mahilig ka sa mga milk tea, ganon. You may want to do it every year or every 2 years. Okay?
Alright, thank you, Doc. May follow-up question lang po. Ongoing po ang pag-take ko ng medications para sa aking cholesterol at high blood. Sabi ng doktor, dahil din daw po ito sa aking lifestyle, malaki na po ang nabawas sa aking timbang at di pa uli ako nakapagpakonsulta. Maaari ko na po bang itigil ang aking gamot?
Depende sa resulta ng laboratorio mo. At saka number 1 yon. At saka number 2, depende sa meron ka bang ibang sakit. Meron ka bang high blood, meron ka bang diabetes. Number 3, ilang taong ka na ba? No? Kasi kung medyo may edad na, 60 and above, medyo mas madalas ang testing talaga. Hindi mo pwedeng ihinto ang mga gamot mo na binibigyan ka ng protection. Yun lang ang gusto kong malaman ninyo, no? Ngayon, kung talagang medyo hirap sa budget, no? Naku, Doc, hindi ko naman kaya yung 3 tableta. So, ang tanungin ninyo, yung doktor ninyo, kung anong pinaka-important dun sa mga tableta na yon. And then all the rest, exercise na lang, at saka modify nyo na lang yung pagkain ninyo. Okay, so may factors din tayong consider bago ninyo i-stop ang mga medicines ninyo. Wag bigla-bigla.
Okay, thank you, Doc, for answering. We have another question. Mukhang ang dami pong question sa ating chat box ngayon, Doc. Grabe ang engagement natin sa ating audience. Doc, kaya pa bang ibaba yung cholesterol level na 6.4, 65 years old through exercise?
Siyempre naman. 65 years old, mag-exercise ka, hahangaan kita kung pasyente kita. Because most of my patients above 60, tinatamad na mag-exercise. So, kayang ibaba yun. In fact, sometimes, no, pagka nag-exercise ka talaga, sasabihin ko, sige, pwede mong ihinto ang cholesterol medicine mo, mag-exercise ka. Pero after a few months, let's say after 3 or 6 months, uulitin natin ang test, tignan natin kung gaano ka-successful. Kasi yung iba, Loven, alam mo, nag-exercise pero kain din naman.
Dok, huwag naman masyadong
Na-hurt ka
after.
ba? Natatamaan ka ba?
Yung medyo
Yun ang
rigid talaga na
Yes, yun ang
jogging tapos
problema
manginasal after.
Yun ang problema. Exercise na exercise. But they keep on eating high cholesterol food. So parang baliwala din.
Okay. Noted po dyan, Doc. Okay. Marami po tayong taga-qualified na makaka-relate po sa inyong tip. So, next po, Doc, na question. Doc, ask ko lang po, gaano po kadami ang pwedeng kainin na avocado? Di po ba mabilis mag-increase ang cholesterol?
Nako. Ganito po. Honestly, hindi ko po alam kung gaano karaming avocado. Baka maano po Pero masasabi ko lang po, marami hong mga write-ups, no? Marami mga journals merong silang binibigay na 10 healthy food for your heart. Isa po doon ang avocado.
Okay.
Meron po siyang cholesterol, pero actually, mababa po yung bad cholesterol niya, mas mataas po yung HDL. So, avocado lang po. Huwag niyo lang isipin yung very healthy. Okay? So, at saka avocado kasi seasonal. So, hindi ka naman kakain yan every day, every year. No?
Mm-hmm.
So, habang meron pong avocado, sige lang. Wala akong problema.
Okay. So, safe po ang mga mahilig sa avocadoria. So, safe po ang ating puso. So, thank you, Doc. Next po, Doc, nakaka-apekto rin po ba ang hypotension sa development ng heart disease? Any advice po how we can keep being healthy in that case po?
Okay, hypotension. Ang ibig sabihin po ng hypotension mababa po ang blood pressure. Okay. Ganito po, ang mga tao, iba-iba po ang blood pressure. Meron pong talagang normal sa kanila, ang blood pressure nila nasa 90/60 lang. Normal po 'yon. Normal pa rin po 'yon. And then there's no such thing as hypotension nakaka-apekto ng heart disease. Wala po 'yon. Hindi po related ang hypertension kasi po pagka hindi po gusto sa iyo, hindi fit sa katawan mo yung blood pressure mo. Let's say ang usual blood pressure mo 120, 130, tapos bigla ka nag-hypotension, bigla ka nag-80/50, tapos nanghihina ka. Hindi hindi healthy 'yon. So hindi related ang hypotension sa health ng heart.
Okay, Doc. Ito, Doc, ang sarap nung kanyang nabanggit na pagkain dito sa kanyang question. Is ginataang ulam high fat?
Yes, higher than regular yung stewed ba tawag doon, Loven, yung magpiprito ka ng garlic, onion, di ba piprito yung ano po tawag diyan? Yung di ba pag nagluluto ka minsan may oil tapos lalagay mo yung sibuyas.
Gisa.
Yung gisa.
Okay.
Yung higher actually it's a little higher than yung mismong gisa lang.
Mhm.
Okay? So okay po, healthy naman po ang coconut oil but again, not very often. Wag lang pong madalas.
Okay, Doc. So, wag po masyadong madalas kahit masarap po ang ginataang ulam. So, Doc, next question. Good morning, Doc. Ask ko lang po kasi nagpa-check up ako sa Qualimed, diagnosis with high blood and diabetes. Yung kaliwang mata ko po, hindi makakita. Sabi ng ophthalmologist, need pababain yung BP at blood glucose para matreat yung cataract. Second opinion naman po, sabi hindi na raw necessary iyon. Alin po ang susundin ko?
Okay, kasi ang problema sa high blood at diabetes, pwede ka talagang mabulag. Pero ano to dito sa question na to, Loven, parang hindi naman siya bulag talaga, no? So I would guess na hindi makakita, ibig sabihin malabo talaga yung mata. Okay? So siguro 'yan ang ibig sabihin ni Mr. Dante, no? So Mang Dante, sa tingin ko hindi lang kayo masyadong makakita dahil sa cataract. Kasi po, yun po ang sinabi sa iyo ng ophthalmologist mo, hindi naman ibig sabihin na may katarata ka, hindi ka na makakakita. Ibig sabihin, pwede talagang super malabo. Pwede talagang super malabo ang mo dahil lang sa katarata. So ako sa tingin ko, mas maganda na maalis mo yung katarata mo para makakita ka ng mas maganda. Yun lang sa tingin ko, very limited ang tingin ko sa ang information na makukuha ko sa tinype mo sa chat box. Pero Dante, sa tingin ko, ang reason kung bakit ka hindi makakita dahil sa katarata mo. Hindi naman dahil pa sa high blood at saka sa diabetes mo. So that is from the ophthalmologist. Siguro, kailangang i-verify mo sa ophthalmologist mo kung talagang pag naalis yung katarata mo, makakakita ka ulit. Yun lang.
Thank you, Doc. Before we proceed on the next question, sabi po ni Ma'am Consolacion, our partner clinic, thank you, Doc. I will visit you soon to make sure maganda po ang puso ko. I'm 62 years old. Well, thank you, Ma'am Consolacion. All right. So our next question, apple cider gummies are out on the market. Recommended niyo po ba yun, Doc?
Why not? But look at the sugar content. Okay, hindi ko pa nakikita yung apple cider gummy. Okay. Basta ang alam ko lang, gusto ko rin kumakain ng gummy kasi ang sarap nguyain ng lambot. But hindi ko alam ang sugar content. So if you are princess, if you are from a family na diabetic, you may want to take a look at the insert, no? Yung sa insert na doon sa etiketa, ng So yun ang Yun ang gawin mo.
Okay po. Sige, Doc. We're down to last two questions, no? So first, hi, Doc. What can you say about generic medicine? Some branded meds are so expensive.
Okay. Sa generic medicine po, no, we're talking in general generic medicines. There are two things na dapat i-consider niyo po sa generic medicine. Una po, there are a lot of generic medicines sa market sa Pilipinas na dinadala lang dito, ini-import na lang ng mga kumpanya or mga individual na tao. Pero hindi po nagkakaroon ng examination. Ibig sabihin, bioequivalent studies, for example, hindi na ho nag-undergo ng mga test. Okay? So if you happen to take a medicine, let's say, uminom po kayo ng isang generic medicine, mura lang. Tapos nabili niyong 5 piso lang, 2 piso lang. Tapos tinitake nyo. Minsan wag po kayong magtaka kung hindi nagiging effective. Kasi po, marami pong generic sa atin na hindi tinetest, hindi nag-undergo ng test. So, minsan, yung laman na active medicine, for example, marami po sa inyong high blood na losartan. Let's say yung active medicine na losartan sa isang tableta, minsan po, nasa 40% lang yung losartan sa isang tableta. So pag tinitake nyo po, you are taking only yung 40% na gamot. Dapat nagtitake ka at least 80-90% ng gamot at least. So kulang po ang epekto. So yun isa pong problema sa generic medicine. Number 2 po, hindi po usually nire-reveal ng mga companies, ng mga generic companies, ang composition ng medicine mismo. Kasi po minsan, meron siyang mga impurities. Minsan may kasamang acid pa. Kasi sa manufacturing ho ng mga medicines, minsan po, yung mga kumpanya para makatipid at mas mababa ang paggawa ng gamot, hindi na ginagawa yung mga ibang procedures, ibang steps para makatipid. So minsan po merong natitirang mga impurities sa gamot. Kaya yun po ang medyo delikado minsan. Ngayon po, meron naman po mga generics na test, mas mura pa rin po siya kaysa sa branded. Ang branded po kasi, pag sinabing branded, yan po yung mga original na mga medicine. Okay? So, marami pa rin naman pong maayos na generic ngayon.
Thank you, Doc, for enlightening us between the branded and the generic. Meron pala talagang difference. Dahil it's like 40% lang yung effectivity ng generic.
Minsan. Merong ganun lang. Oo.
Okay, Doc. Noted dyan. Okay, so last question tayo, Doc. Doc, I'm 45 years old. Si Ma'am Decan Las po ang ating marketing manager from corporate. 45 years old, overweight, pero pasok pa sa 85% ang waist-hip ratio. Pwede ko pa po bang dayain sarili ko na okay pa ang puso ko at hindi pa ako masyadong at risk for heart disease?
Ikaw na rin nagsabi, Day. Dayain. Bawal man daya. Kailangan, remember, the waist to hip ratio is just one parameter. There are other parameters, no? So, yun ang iisipin mo lagi. So, maganda, masaya, nasa 85% ka pa lang. So, ang gawin mo na lang, try to look into the other aspects or other parameters. So, wag yan lang ang basis mo. Tumingin ka pa sa iba. Okay?
Alright, thank you so much, Dr. Melco. So, nawa nasagot namin ang inyong mga katanungan ng naaayon. Once again, thank you, Doc. Ang dami namin natutunan, no? Maaari niyo pong bisitahin si Dr. Melco Perez dito sa Qualimed Hospital, San Jose del Monte. Tuwing Miyerkules, Wednesday, 9 a.m. to 11 a.m., Medicine Clinic, Room 201. Para sa mga katanungan at appointment, maaari kayong tumawag sa 044-307 0000 local 201 or ang mobile number 0967-316-1189. So maaari niyo pong i-screenshot yung screen niyo para sa mga details. Ulitin ko lang po yung contact number po, no? Landline 044-307-0000 local 201 or ang mobile number po 0967-316-1189. Alright. So, thank you so much, Doctor. Ngayon, nasasabi kami ipahayag sa inyo ang aming ongoing promos. Maligayang buwan ng mga puso, bumibilis ba ang tibok ng puso mo kapag kasama mo ang taong mahal mo? Upang matiyak na ang pakiramdam ay pananabik o kaligayahan at hindi isang sintomas ng maagang pagpalya ng puso, subukan ang aming Healthy Heart Package. Healthy Heart All-Year Package 1, valid from February 14 to December 31, 2022. Inclusions are arterial and venous duplex scans, available for only 8,330. Our Healthy Heart All-Year Package 2, valid from February 14 to December 31, 2022. Inclusions are 12 lead ECG and 2D echocardiography tests for only 3,320. And lastly, we have Healthy Heart Limited Time Package, valid from February 14 to April 30, 2022. Inclusions are 12 lead ECG, 2D echocardiography test, and chest X-ray for only 3,771. Packages are priced 10% lower than the regular services, professional and consultation fees not included. Limited to outpatient, cash, or credit card transactions only, and promo rate cannot be concurrently availed with any other discount or HMO. Ngayon po, para sa inyong mga questions, no appointments, meron po tayong contact details sa ating official poster for QSJDM Radiology Department, 0917-842061. For the QSJDM Heart Station, 0917-815691. For QSJDM General Laboratory, 0917-815661. And for the QSJD Information, landline po tayo, 044-307-0000. Bukod dyan, huwag tiisin ng katawan, physical therapy ang kailangan. Our 5+1 PT package is available from February 1 to December 31, 2022. Valid for cash or credit card transactions only. Packages cannot be concurrently availed with any other discount, senior citizen, or PWD. For inquiries and appointments, ang landline po ng ating rehab ay 044-307-0000, local 109. Or ang mobile number 0917-801-8350. Okay, so ngayon po para sa ating closing remarks, salubungin po natin ng virtual clap ang ating Chief Operating Officer ng Qualimed SJDM, Mr. Ramon S. Abadilla. Hi, sir.
Okay, thank you. Thank you, Loben. Thank you very much, Doc Melco, my cardiologist. Guilty, no? Dami kong guilty after this talk. Very important to find out a lot of things. Apple shape pala ako, no? And I need 15 years to remove the smoke taste that I developed for smoking for so long. Thank you very much, Doc. I guess I hope the talk that we have given today and the practical health advices that were given are very helpful to everyone. I see that we have a high participation this morning, and I'm hoping that they understand why we are doing this. No, one is to increase the awareness on healthcare. After the pandemic, we have found out the vulnerabilities that we have, especially the relationship of the comorbidities that we have in relation to the virus. No, so essentially what happened was that it opens our mind that the virus is just something that can affect us, but our comorbidities, especially for our heart and our diabetes, could actually impact it and make it more severe. So I'm hoping that the talk that we have, the services that we offer, and I just wanted to also add to it, we have opened 3 special centers, our hypertension centers, diabetology, and also our geriatric are available now. We just launched it last December, and it's related to a lot of things that we're doing today. Doc Melco, thank you very much. No, I really appreciate it, and I hope I see that the survey poll is showing an excellent rating for the talk. Thank you very much, and I wish that
Thank you.
all of you who are attending could tell your other folks and share I think this one will be uh, uh, the tape of this talk will be in our Facebook. So share the Facebook Live, no, and then share it so that people could get the benefits of the information that was imparted to us by Dr. Melco. Thank you, Dr. Melco. Thank you for everyone,
Thank
our
you.
partners, and everyone there. Thank you very much. Over
Thank
to
you,
you.
Sir Ramon. And thank you, Doc Melco. So, looks like we have covered everything. Maging updated sa aming mga promo at libreng usapang pangkalusugan sa pamamagitan ng pag-like at pagsubaybay sa aming opisyal na Facebook page, Qualimed Hospital SJDM Bulacan. So, it's a wrap, everybody. Thank you for participating in today's webinar. We hope to see you again next time. Stay safe and God bless.